for the best possible results. How far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Hello and welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm Melissa Hodgson, your host today, and I have with me 2 of our parish's leading healthcare executives. Patty Ellish, President and CEO of St. Tammany Parish Hospital, and Dr. Ed Martin, Medical Director of Ochsner Health System's North Shore region. They'll give us some background about what's happening in the federal healthcare industry that affects their caring work here in our parish, and they'll tell us how the partnership between Ochsner and St. Tammany is working, now that it's a little over a year old. We will start with Ochsner's Dr. Ed Martin. Welcome, Dr. Martin. We're glad you're here today.
Thanks, Melissa. It's great to be here.
So we're talking a little bit about Ochsner and St. Tammany and this partnership. It's about 1.25 years old, launched in the fall of 2014. But for our viewers, why are hospitals doing these alliances? What's going on?
Melissa, it's no secret that healthcare in this country has been under a tremendous amount of change over the last decade. We have had increases in cost, which is driven mainly by technology increases and new developments in medications. We've had significant federal policy changes. New laws have come into effect, which healthcare industries have had to adapt to. We've also had a significant problem with access. Patients need to be seen, especially for preventive services, and they need to see primary care physicians. And unfortunately, there's a large shortage of this specialty in our country today. If you look across the country, we see many of these arrangements occurring. We see them on the East Coast, on the West Coast. We see them in large markets like Chicago and Cleveland and Houston. And this has become a trend all across our nation. About 10 years ago, we all experienced the most devastating event in our region, which was Hurricane Katrina. Ochsner at that time was a single hospital system. But during that storm, we had many hospitals, especially on the South Shore, closed due to damage. Fortunately, Ochsner was able to keep its doors open, and we were able to repair the damages that we sustained. We were also able to maintain our staff, which allowed us, during the storm and in the aftermath of the storm, to continue to give care to the patients of our region. We also saw this as an opportunity to take the healthcare industry in New Orleans to the next level. Ochsner decided to purchase 3 hospitals on the South Shore, including a hospital in Kenner, a hospital on the West Bank, and a hospital in Uptown. And over the last 10 years, we have tried to bring those hospitals to a higher level of quality to provide care to the citizens of the greater New Orleans area. We saw it as a way that we could participate in the rebirth and revitalization of the healthcare industry in our area. And so we started our growth at that time to become a system with many hospitals and many clinics over the course of that period. Ochsner sees itself as a leader in quality in the state of Louisiana and in the region. And as the largest provider in the state, and as the largest non-governmental employer in the state of Louisiana, we really feel that we have a responsibility to lead, to improve things in our state and our region in the healthcare industry. So over the last several years, as opposed to buying more hospitals, we've looked around the state and the region with partners who share similar goals to ours to be able to align with them and to take our common vision and goals to the next level, and to have them and us work together to improve health care for our citizens. In West St. Tammany, it was a perfect example of this philosophy. Ochsner for many years, actually the last 30 years, has had a presence on the North Shore, but we've never had a hospital in West St. Tammany Parish. So although many of us as physicians have worked in the high-quality institution of St. Tammany Parish Hospital and know its great reputation, it was never more than just a physician-hospital relationship. But the new philosophy that Ochsner's had in partnering with other facilities of like mind, especially other not-for-profit facilities, led us down the path of engaging with St. Tammany Parish Hospital to form one of these partnerships that we alluded to earlier. We both felt it was the right thing to do to go forward for both of us, and moreover, we felt it was the right thing to do for the patients and the citizens of St. Tammany. Partnering with each other is a great way to reduce costs, to increase quality, and to increase access. And those are the aims that we have at this time. In addition to partnering with St. Tammany, we have several other affiliations around the state. We're affiliated with Christus, and we're affiliated with Lafayette General, and there's many others. But St. Tammany was one of the founding members of the Ochsner Health Network. And the Ochsner Health Network is trying to partner with the strongest and highest quality providers in the Louisiana and the Gulf South region. To face this new healthcare reality together, we'd like to show you a little clip about the Ochsner Health Network.
Great, let's take a look at that. And that's really how the ball got rolling, isn't it? Better together, stronger together. And in the case of Ochsner's partnership with St. Tammany, the two hospital leaders began to really look at how to embrace the triple aim, which of course is increased quality, the exceptional patient experience, and an overall reduced cost of care.
That's correct, Melissa. This triple aim has become famous over the last several years, and it's very important if we're going to do those things that I talked about earlier. Our goal is to increase the scope of care in West St. Tammany Parish so that we can bring specialists to this area who many patients had to cross the lake to see before. We want to provide a seamless transition for complex cases, cases that could not be handled in a community hospital and need to be handled in a more quaternary facility such as Ochsner Medical Center on Jefferson Highway. We'd like to be able to coordinate our clinical strengths to serve our patients better. And of course, to reduce cost, you also have to eliminate duplication. And that's one of the goals that we have as well. We're able to leverage our collective size to get better costs and better pricing from our vendors, which ultimately helps keep the cost of healthcare down in our area. To do this, it's not just important for hospitals to come together and collaborate. It's very important for physicians to partner and align with each other. And the way that physicians partner is around quality and safety and the patient experience. And all of this together will help to decrease costs and improve the level of care that we're providing in the community. None of this happens without the physicians on board with these ideas. And physicians are naturally people who want to serve and people who want to see the quality increase in the profession that they've chosen. The first thing that you have to do with physicians is to establish trust with the community physicians, because you have to remember, before these partnerships, we were actually business competitors to a degree. And I don't think any of us felt comfortable in that role, but this has given us an ability to work more closely together, and I think the ultimate beneficiary of that is the patient. So in addition to establishing trust, we're creating alliances with each other. We're sharing call with physicians we may have not had the opportunity to work with before. We've created what I like to call a golden triangle, where you have physicians that are employed by St. Tammany and physicians that are employed by Ochsner Health System, working closely with physicians who are independent in the community. And when we all work together and use a common medical record, which Patty Ellish will tell you a little bit about a little later, this gives us a unique advantage to deliver higher quality care. And of course, that's what it's all about, is trying to rally around quality. Some early accomplishments of the partnership have been exciting. We've been able to establish a pediatric subspecialty clinic in Covington, as I said before, to bring subspecialists across the lake to be nearer to the patients. We've also had at least 3 high-performance network contracts that we've put together with our relationship. We've recruited already a pediatric orthopedist, a neurosurgeon, and multiple neurologists to our community because we had needs in those areas, and there's more to come. We engaged an architect to do a joint master planning for our facilities, because one of the biggest wastes of having multiple systems is too much bricks and mortar. And if we can all come together and use the space efficiently, once again, that cost will save money, or reduction in that cost will save money. So where are we today? Well, our current initiatives are several. We're trying to integrate clinically to improve care and reduce costs. We're trying to combine facilities, and to date we've already been able to combine our sleep labs. We also have combined our cardiac catheterization labs, and we're in the process of trying to combine our infusion suites. These combinations of services and the consolidation of services will greatly help keep the cost of health care down and improve the quality by standardizing across the network. We've also introduced provider-based billing, which is another way to keep the community with health care needs that need to be met. So with that, I think we're looking forward to new, more and exciting opportunities to work together.
Outstanding. Well, Dr. Martin, thank you so much for this update. It's exciting to hear all that Ochsner and St. Tammany are doing together in West St. Tammany, and what's been accomplished so far in just a year and a quarter really, of this partnership. After this short break, we'll be back on Healthy Living, brought to you by St. Tammany Parish Hospital. We'll speak with CEO Patty Ellish from St. Tammany, and she'll talk a bit about what 2016 and 17 have in store for the patients of West St. Tammany through the partnership of Ochsner and St. Tammany Parish Hospital. We'll be back after this.
When it comes to your family's health, you want the best. That's exactly why St. Tammany Parish Hospital and Ochsner are now working together. By uniting 2 of the highest quality healthcare organizations in the state, we can bring everyone in St. Tammany Parish a higher level of specialty care with advanced procedures and the most advanced technology. Because when your healthcare is better, so's your life.
Next, we'll speak with St. Tammany Parish Hospital President and CEO Patty Ellish about where the alignment is taking us. Patty, welcome back to the show. We're glad to have you.
Thank you, Melissa. I'm glad to be here.
Now, I know we're going to talk a little bit about where the partnership's going. We'll talk 2017, but you had some really exciting milestones in 2015. So tell us a little bit about how the partnership ended. Partnership ended the year.
Oh, indeed. We had a very successful year in 2015, some 16 months into the partnership. I think for the 2 partners, Ochsner Health System and St. Tammany Parish Hospital, we envisioned that we would serve more patients, and we delivered on that promise. We've seen the cardiovascular service grow by 33%. Our Center of Excellence, using St. Tammany Parish Hospital's cardiologist, coupled with Ochsner Health System's cardiologist, coming together, combining those resources and identifying what could we deliver in advanced care at our hospital, translated into more cardiovascular surgeries being performed at St. Tammany Parish Hospital. As you heard Dr. Martin mention, Ochsner Health System is using St. Tammany Parish Hospital as its destination hospital, and so we've actually provided through a joint management committee the ability to bring those professional providers together to identify what more could we do to improve the quality and decrease the cost and provide a better patient experience in the community. And in doing so, we've seen the increase in cardiovascular surgeries. We've seen the increase in more patients using St. Tammany Parish Hospital. We've had an increase in live births by 6%, which is kind of nice to see those families continuing to grow in our community. We also, as we've, through the Joint Management Committee, decided decided that, what could we do to avoid duplication and redundancy? And so what we've seen is we both had sleep lab facilities, those to do necessary testing for those patients, identified, but both had capacity. So how could we combine those two centers, provide increased access and in a more timely manner, using both resources coming together? We now have one sleep lab, and we've seen a 92% increase in the number of sleep lab studies that we've performed together. So the notion we're better together was certainly realized in 2015 through increased access for our patients, more efficient operations inside the two facilities. So we feel like 15 was a resounding success.
Excellent. And one other aspect of 15 where we saw some change and improvement was for patients who are in outlying areas around West St. Tammany who benefited from something called the Regional Referral Center.
Yes, Ochsner had a very comprehensive regional referral center that now St. Tammany as a partner participates in that. And that allows providers in the remote areas, not only hospitals, but physician providers that are out there seeing patients that need patients transferred into the most appropriate facility to come through a one-stop shop regional referral center. That center triages patients accordingly. Previously, those patients might have gone outside of their communities for that care, but instead they've been directed. St. Tammany Parish Hospital actually saw an increase of 338 more patients being served locally in 2015. And for us, that was a real success. Patients would much rather receive that high quality care close to home.
Very good. Well, and in terms of patients and something that 2015 brought for the patient, the hospital has a new electronic health record.
We're very excited about the fact that through our partnership, we've been able to access the EPIC solution. That EPIC solution is an enterprise-wide electronic health record. More importantly, it provides the teams at our hospital the ability to electronically input important data inside of a comprehensive portal. More importantly, for patients, our patients can access that portal through the My Chart link at St. Tammany Parish Hospital or at Ochsner Health System. That patient portal brings information to the patient. So it's really nice for us to deliver efficient care inside of our facilities or in our physician offices. But for me, this enhancement is going to allow patients to get access to their own information. They should be able to register online. They should be able to access their health summary. The communication tools between the provider, the physician, and his patient is available through that patient portal. Request prescription renewals. For me, it's almost like giving the patients now, putting them in the center of their care and allowing them to access that information through the My Chart link on stph.org.
Wonderful. So stph.org/mychart. It sounds like an excellent convenience for patients, but also giving them, or giving us as patients, the ability to look at our own information and communicate with our own physician. And when we have care at St. Tammany Parish Hospital or a St. Tammany Hospital physician network, or the Ochsner facilities, we can see all of that in our own My Chart.
And that's the beauty about the integrated electronic health record and us being able to have that seamless information flowing back and forth between providers, hospitals, and now patients.
Great. Well, all right, that's a little bit of how we wound up 2015, but tell us what's coming in the partnership. Ochsner and St. Tammany have some pretty exciting things going on in the next 2 years.
Yeah, as we pivot off of 15 and think, what can we do together in 16, we're excited about the delivery of some new programs. One of those new programs for us, as St. Tammany Parish Hospital finishes up on its 3-year, $21 million expansion of our emergency room, as well as bringing about a new 21-bed, all-private all-private patient wing in a healing arts environment. That expansion allows us to continue to have space to be able to grow here in the community. The pediatric emergency room is really one of the highlights of our new expansion. I'm so excited to be able to take care of our littlest patient, and for us, over a third of the patients coming into our emergency room are under the age of 18. So this is really an opportunity to deliver facilities to that specialized patient, an area designated for children, moms, dads, and families, to be able, if someone needs an emergency room, to be able to care for them in that type of space. More importantly, we have the subspecialist. Through our partnership with Ochsner Health System, we've created the opportunity for those pediatric subspecialties to set up a clinic here and to have access to those well-qualified physicians that otherwise moms and dads had to go to the South Shore to access. So the facilities as well as the professional services combined to deliver an advanced level of pediatric care in Western St. Tammany. So
better
for us,
together, stronger together.
Absolutely, Melissa. I think we're certainly trying to deliver on that promise, and the notion is we are better together, and in 2016 our community will benefit from that.
Beautiful. Now, something else in the emergency department is a designation. It's called Trauma Level 3.
That's correct. Trauma Level 3 is a designation established by the Louisiana Emergency Response Network. It really is an opportunity to say, what resources do you need to care for that trauma patient presenting to your emergency room. Just 2 weeks ago, I attested to those services and professional capabilities. That designation will allow patients that otherwise might have been diverted from our facility to go to a hospital that had that. Indeed, those patients will stay now closer to home. We're elevating the care in our emergency room through this trauma level designation, and we're excited to be able to say you can come to our facility to receive that advanced level of care.
Wonderful. Now, those are all advancements and improvements that are occurring at the main hospital campus, but there's some exciting news coming down next year or late this year in Mandeville.
There is. We're actually opening the first, what I would call 24-hour a day, 7-day a week emergency room, what I would call a freestanding emergency room. That's something unique and different. It's unlike an urgent care, unlike a minute clinic. This is actually a higher level of emergency care, but delivered in a distinct location that provides advanced personnel, as with a board-certified emergency room physician, including the facilities needed to promptly treat, and diagnose a patient that wants to get in and get out. Obviously, for our community, access and efficiency is very important. This 24-hour a day freestanding ED in Mandeville will provide them with the finest facilities, including a CAT scan, which, unlike minute clinics or urgent cares, those facilities are not available unless they're typically in a hospital. Instead, this freestanding emergency room will have those finest facilities. For us, getting you in and out in 30 minutes is our charge, and we will deliver on that promise.
That is really exciting.
Yes.
Expansion of emergency. Now, there are also some other opportunities. Tell us a little bit about the plans for a rehab hospital.
Indeed, with elevation of care as the joint management committee between Ochsner Health System and St. Tammany Parish Hospital continues to figure what is it that our community needs and how can we elevate that care. Neurosciences is one of those areas. For us, we received our stroke designation in 2015, and we're really proud on what that means to patients. Patients can get prompt treatment, but in the event that patient needs continued rehabilitation, we have an inpatient rehab facility at our hospital. We think to be able to build on those capabilities and bring more necessary services in the form of neuroscience care is going to complement that. So what that translates into is a new 44-bed hospital that is being planned in Western St. Tammany to afford us with the capabilities and the professional technology and to be able to care for those patients in the region. So we're excited about expanded rehabilitation services in our community.
Wonderful. And then I think one other 2016-17 initiative has to do with further integrating the comprehensive cancer strategy for West St. Tammany.
Yes, indeed. Currently, St. Tammany Parish Hospital and Mary Bird Perkins Cancer Center have been together since 1998. The opportunity exists for us to really talk about delivering care with our partner. So Mary Bird Perkins, St. Tammany Parish Hospital, and Ochsner Health System are really forming a partnership between the three of us to really bring more comprehensive cancer care services to the community. We're just in our planning stages now, but we see a tremendous opportunity for clinical trials, for multidisciplinary teams, collaborating about what is it that the patient needs and how we can best deliver on that. So really the notion better together, delivering high quality care at the lowest possible cost is what we've been able to deliver on and will continue to do so in 2016.
Outstanding. Patty, it sounds like quite a year coming up for the partnership, for the hospital, for Ochsner, all focused on the triple aim, improving quality and safety, improving the patient experience, and reducing the overall cost of care.
Yes, Melissa, we're excited about what 2016 will hold for us.
Thanks so much for joining us. I'm Melissa Hodgson, today's host for Healthy Living, brought to you by St. Tammany Parish Hospital. We've talked today with Dr. Ed Martin from Ochsner and Patty Ellish from St. Tammany about the industry and healthcare and what's going on with the partnership in West St. Tammany and how that affects you and improves your health here close to home. Please join us next month when your usual host Amanda Paxton will be back with another episode of Healthy Living, brought to you by St. Tammany Parish Hospital.